Hi, my name is Megan Krauski. I am a nurse at Alverno College, and I'm going to be giving you a presentation on interpersonal relations in nursing, Hildegard E. Peplau's theory. The objectives for this presentation are to identify and explain the theorist and her reasoning for the development of her theory, to understand the main concepts of the theory, and to apply the theory to the APN role using a case study. Hildegard E. Peplau was born in 1909 and died in 1999. In 1931, she received a diploma in nursing. In 1943, she received a BA in interpersonal psychology from Bennington College. In 1947, she received an MA in psychiatric nursing, also from Bennington College. She received her doctorate in education, specifically in curriculum development, from Columbia University in 1953. She has worked as a private nurse, a general nurse. She worked in the U.S. Army. She did nursing research, and she was also a psychiatric nurse. She became a publisher in 1952. She worked with the development of the National Mental Health Act of 1946. She participated in the World Health Organization, the National Institute for Mental Health, and the Nursing Corps. She helped develop the first CNS program in psychiatric nursing. The purpose of the interpersonal relations in nursing theory was that Peplau believed that nursing was a therapeutic tool because it was a healing art assisting an individual who was sick or in need of health care. The interpersonal process she defined as an interaction between two or more people with a common goal. The common goal provided the incentive for the therapeutic process or relationship. Each person learns and grows from the other person, and they respect each other. In her theory, the role of the nurse is many different things. The nurse could be a teacher, resource, counselor, leader, technical expert, or surrogate. In 1952, Peplau had 4 initial phases to her theory: orientation, identification, exploitation, and resolution. In 1997, she condensed those phases to orientation, working, and termination, and I'll go into more detail about each one of them. During the orientation phase, the nurse and the patient meet as strangers. Building a trusting relationship is key. Both the nurse and the patient are directly affected by the attitudes regarding giving and receiving aid. The nurse must always be aware of her personal bias and attitude. The patient and nurse must work together to recognize, clarify, and define the existing problem, or the problem that brought the patient in the first place. Once this is done, the patient and nurse can then move to the working phase. During the working phase, a more intense therapeutic relationship develops. The nurse aids patient using services to solve the problems that brought the patient in. The patient responds to the nurse, who meets his needs. The patient plays different roles. The patient may be a participant or interdependent on the nurse, autonomous or independent from the nurse, or passive, completely dependent on the nurse. Continuous clarification of each other's perception and expectations during this time is needed. The patient begins to accept services offered from the nurse. During the termination phase, all patients' needs must be met. The termination of the relationship may be difficult for both the nurse and the patient, or the nurse, the patient, and the patient's family. Successful termination is when the patient becomes independent from the nurse. All patients' needs are met, and the patient is able to make goals independent of the nurse. The termination phase can only happen if all other phases have been successfully completed. Understanding Peplau's theory in regards to the advanced practice nurse. The advanced practice nurse must understand themselves and the patient as they begin practice. They must not let self-bias influence the practice, or the patients will not develop a trusting therapeutic relationship. The APN must allow patient autonomy when setting goals. This allows for better outcomes. Together, the nurse and patient can achieve specific goals in which the patient first sought help for. The advanced practice nurse can help the patient discover and use resources available to reach the patient's goal. The advanced practice nurse must recognize when the mutual goals have been met. The advanced practice nurse then helps the patient establish new independent goals without the nurse. Both the advanced practice nurse and the patient become mutually satisfied with the outcomes during their therapeutic relationship. I'll now talk to you about a case study. AB is a 56-year-old married female with 2 grown children admitted to Kathy, the APN's inpatient hospice unit, with a terminal diagnosis of glioblastoma multiforme and a prognosis of less than 3 months. Her diagnosis was made 2 years ago, and she underwent radical surgery, which left her with facial deformities. Since initial surgery, AB has undergone chemotherapy and radiation therapy. She was taken to the emergency department less than 24 hours ago with increasing headaches and the inability to walk. At the emergency department, an MRI confirmed that AB's tumors had increased dramatically in size, and she decided to enter hospice instead of receiving palliative chemo and radiation. She comes in understanding what hospice care is. However, she is still reluctant to receive medications for her pain, in which she rates a 7 out of 10. She states, "I just want to be awake as long as I can with my family." The orientation phase begins. Kathy, the family nurse practitioner, introduces herself to AB and her family. Kathy is in the room and hears AB state that she doesn't want pain medication at this time, even though her pain is a 7 out of 10. Kathy sees this a lot with patients, and even though it upsets her that the patient is in pain, she respects the patient's decision. She educates AB on different ways of controlling her pain, and also on the medications that may make her drowsy, but she could start off with and acclimate quickly to. Kathy, the FMP, discusses with both the patient and her family the decision to come to hospice, to get a better idea of how they can work together to establish goals. Assessment of the patient to establish a therapeutic relationship is key. Personal bias was left out and not pushed on the patient, and trust was therefore established. The working phase. During the next few days, Kathy, the FMP, asks AB what her goals are while she is in hospice care. AB states that she would like to spend as much time as she can with the people she loves before she becomes too sick. Kathy includes AB's family in the goal-setting process. They agree, however, they also state that they would like the patient to be as comfortable as possible so she is able to actually spend time with them. Kathy discusses other issues with the patient regarding skin integrity and the inability to walk. Together they come up with goals of pain control, starting with the lowest dose analgesic, catheter placement for comfort, skin integrity, and energy conservation, how the patient will be treated once she is no longer able to make decisions, and sources of grief counseling for her family once she is gone. The termination phase. AB steadily becomes weaker and needs increasing pain medication. She eventually dies 23 days after her initial admission to hospice. Kathy comes to her bedside after death and sits with her family until the funeral home picks AB up. While the family is extremely saddened by AB's death, they do express gratitude for the ways she was treated and the way her wishes were carried out. Kathy again discusses grief resources that are available to the family and gives them numbers to call. She asks the family if there is anything she can do for them, and they state, "No, you've been extremely helpful," and she would have been so happy you listened to her wishes. Kathy hugs the family and tells them she will keep them in her thoughts. The family leaves after AB is picked up, and they again express gratitude in all of her care. The termination phase is met. In conclusion, Peplau's theory is based on a therapeutic relationship between a patient and the advanced practice nurse, or nurse in general. The advanced practice nurse must understand herself to work with the patient and leave her bias out. Trust will not be formed if this does not happen. There are 3 phases of the theory, and each must be completed to move on to the next. Peplau's theory can be applied in any APN situation. Thank you and have a nice day.